Hi guys, welcome back to my channel. It's your girl Toya from All About Nursing. Today we're going to continue our dosage calculation series. We're coming close to an end for now and move on to our next topic. But today's topic is going to be insulin dosage calculations. We did the insulin sliding scale previous video, so you can tap on it. It's going to be coming up on the screen now. You can do that, or we can have the playlist on medication dosages. It'll be great. It will just play all the videos on dosages and you can study and practice. Okay, so let's get into this one, insulin dosage calculations. So we know we give insulin to patients that are insulin dependent to manage their blood sugars. So we know that it's very important for it to be an accurate way that we manage these calculations. So today we're going to be doing five different scenarios with 5 different patients, well, case studies basically, and we're going to work it out together. Okay, so our first scenario is a patient with diabetes is prescribed basal insulin dose of 10 units per day. The patient also needs a bolus insulin dose before each of the 3 meals, calculated as 0.1 units for every kg per meal. The patient weighs 80 kgs. How much bolus insulin should the patient take before each meal? Okay, so let's do some maths. So our patient is weighing in at 80 kgs. So patient weight is 80 kgs. And we are giving this patient 0.1 units per kg. So we're going 0.1 units per kg. All right. So from previous exercises, we know we have to multiply to find out how much our doses that we're going to be giving our patient. So from here, we know it's 0.1 units per kg per meal. Okay, so it means that it's going to be 0.1 units for our patient, because our patient weighs 80 kgs. So if our patient weighs 80 kgs, it means we will be multiplying 0.1 by the 80. Okay, because we're giving them 0.1 unit for every kg that they weigh, which will give us 8 units per meal. So we'll be giving our patient 8 units per meal as a bolus on top of the 10 units per day that they get as a basal insulin coverage. Okay, hope that was understanding. Let's go over it. So our patient weighs 80 kgs. Our order is to give 0.1 units per kg per meal to this patient. This patient weighs 80 kgs, so we have to multiply the amount that is ordered by the patient's weight, and we got 8 units, which is 8 units per meal additional to the 10 units per day. All right. A patient requires a correction dose of insulin based on their blood glucose level. The corrector factor is 1 unit of insulin per 50 mg/dL over the target glucose level. The target blood glucose level is 100 mg/dL. The patient's current blood glucose level is 250. How much insulin is needed for the correction? All right. So this is a question. We have to break it down to get the information required to work out the dosage patient is required to get. All right. So first, to begin, what is our correction factor? Our correction factor, we're given 1 unit for 50 mg/dL above 100 mg/dL. So for every 50, we give 1 unit. Okay? So our patient's blood glucose right now is 250. So right now our patient's blood glucose is 250. How do we break this down for us to understand? We know we have to give 1 unit for every 50 above 100. Our patient is 250. First thing, we have to find out how much more above 100 our patient is right now. So you take the patient's level right now, which is 250, and you minus the target, which is 100, and we will get 150. So our patient's blood level is 150 above the target level. Okay? So we know the order says for every 50 above the target level, we have to give 1 unit. How would I know how much is 150? How much 50s is in 150? So I said it. So we divide 150 by 50, which will give us 3. You multiply the 3 by the 1 unit, equals the 3 units. So the order is, our target blood sugar is 100. We have to give 1 unit for every 50 above 100. Our current blood sugar is 250. To find out how much above 100 we have to subtract the target level from the current level. So this is our target level, this is our current level, okay? So 250 take minus 100 is going to be 150. So we have 150 above 100. To find out how much 50s we have in this patient's blood sugar above the target, we divide it by the 50, which is going to be 3, and then we multiply it by the 1 unit, which is giving us 3 units. So our patient has to get 3 units of insulin. I hope that was clear and I made it simple. A patient takes a total dose of 40 units of insulin divided equally between basal and bolus doses. If the patient takes 3 meals per day, how many units of bolus insulin should be taken per meal? All right, so we know when we get these long descriptions, we have to break down the scenario to get the information, okay? So first thing, our patient takes a total daily dose of 40 units of insulin daily. So let's write down that. What is our daily dose? Our daily dose is 40 units. Which is divided equally between the basal and the bolus doses. So did you catch that? It is divided equally. So if I'm giving you a basal and a bolus, which is divided equally, what does that mean? It means that the two of them are equal and they're both equal to the 40 units. So which means we have to divide the 40 by 2. Okay? So to find out how much they both are, because they are divided equally, we divide the 40 units by 2 because it's basal and bolus, which will give us 20 units. So the basal is 20 units and the bolus is 20 units. Yeah? That gives us 40 units daily. Okay? So we have the patient takes 3 meals per day. How many units of bolus insulin should be taken per meal? So we know our bolus is 20 units. So if we have 3 meals, what do we think we do? We're going to have to divide our 20 units by the 3. Because this is the total the patients get for the day, which is the combination of the basal and the bolus. The basal is 20, the bolus is 20. We have 3 meals. They take bolus at each meal, okay? So we need to divide the 20 units divided by 3. it will give us 6.66 units. That is the exact answer. But we know on our insulin syringe, it doesn't have 6.66 units. And from going to school, doing maths, we know when we have 6.66, we're going to round it off to the nearest whole number. And what is going to be our nearest whole number? Our nearest whole number will be 7, because we have 6.66. So this patient will be getting 7 units per meal. 7 units per meal. So, again, this was a tricky one. Our patient total daily dose was 40 units, which was the combination equally of the basal and bolus units. So we had to divide our total by 2, which gave us 20 units. So our patient was getting 20 units of bolus, 20 units of basal. Divide that by 3 meals will give us 6.66 units. We know we don't give 6.66 units when we administer insulin, so you round it to the nearest whole number, which is going to give us 7 units. Okay? So that's our next scenario. Alright? That was tricky. May you think. So let's get on to our next scenario. For our last scenario, let's read. A patient's insulin sensitivity factor is 1 unit for every 25 mg/dL decrease in blood sugar. If the patient's blood glucose level is 300 and the target level is 150, how many units of insulin should be administered to reach the target? All right, let's get into that. So, we know 1 unit for every 25 mg/dL our patient decreases. For every 1 unit we give them, they decrease 25 mg/dL on their blood glucose. Okay, that is what this is. All right, so we're going to write that 1 unit decreases our blood glucose by 25 mg/dL. All right, our patient's blood glucose right now is 300. All right, and our target is 150 mg/dL. All right, so how much insulin do you think we have to give this person who is 300 to get them to this number here, 150? So first to begin, we have to subtract our target from our current. Okay, so we're going to take 300 minus 150 is going to give us 150 mg/dL. Yes, and we know for every 1 unit of insulin that we give our patient, they decrease their blood sugar by 25. Okay, so we need to decrease this whole 150. So how much 25s is in 150? I don't know. You know? Okay, so let's work it out. So we're going to have to say 150 divided by 25. And that will give us 6. All right? And 6 25s is in 150. So we know every 25 we're giving them 1 unit, right? So we're going to multiply the 6 by 1 unit, which will give us 6 units of insulin. Hope that makes sense. Remember, our patient was sensitive. Their sensitivity was 1 unit decreases them by 25 mg per deciliter, right? So our patient blood sugar was 300 and we need to get them down to 150. So we need to know how much was the difference from our target and our current. So our target is 150. Our current is 300. The difference between the both was 150. Then we needed to know how much 25s was in that difference, so we would know how much units of insulin we'll administer. So we had to divide our difference by the 25, and we got 6. So it had 6 25s in that 150, to make it 150, which means for every 25 we give them 1 unit. So we multiply the 6 by 1 unit equals to 6 units. So when we give our patient the 6 units of insulin, our blood sugar should come down to 150 as our target level. Okay? So I hope this quiz was really helpful today. I hope this practicing was great. I hope that you guys were able to understand and grasp how to calculate our insulin dosage when administering to our patients. I hope it was helpful. Look out for more videos. And remember, nurses do it better. Bye.